since the program has made a good start, how the start was that initially, it was a gradual increase in the utilization. So when we started, we were doing, let's say, around 10,000 free treatments, free medical hospitalizations per day. And, as the scheme progressed, it moved to somewhere around 25 to 30,000 before COVID happened. So financing and covering and providing that financial protection for 25 to 30,000 hospitalization per day for the poor and vulnerable is I think a huge scale. And we think that we have just scratched the surface. I think there is still a huge need that we need to cater to, especially in terms of access to the care. So we want to focus on empaneling more hospitals within our network. We want to focus on augmenting the type of quality of care that we are providing to all our beneficiaries. We want to focus a lot on how to improve the beneficiary awareness that they are eligible for this program, because when you are covering 500 million citizens, you need to ensure that they are aware, the citizen is aware about this entitlement. So we have undertaken a lot of efforts, but I think we want to further strengthen that effort so that any particular eligible beneficiary, when it is needed, that beneficiary attains this particular entitlement and uses this. Then there are other things like the remaining 3 states which are still not joined, and they are not implementing this particular scheme. We want to bring them on board and ensure that we realize the vision of one nation, one scheme, for providing this healthcare protection. So there are quite a lot of aspects in terms of the normal operationalization of this scheme. But in terms of COVID, I think the idea would be that how to catalyze the private sector labs, the private sector hospitals, how to get them more engaged in this, and how to ensure that there is an adequate participation from the private healthcare ecosystem in mitigating this COVID situation. Because in the public sector, as I said before, that we are providing free treatment. So in the private sector, we want to ensure that probably we can reimburse the private sector against the beneficiaries who are taking testing and treatment. So as the cases rise, I hope not, but if they do, we want to ensure that we are ready with catalyzing that private sector network, and our beneficiaries and the citizens of the country, they are not denied any type of COVID treatment or even any other non-COVID treatment. So I think that is the type of goal that we want to work towards. I think a lot of learnings, learnings for us, as well as we can share some of the best practices for the globe. I think when we talk about us sharing some of the best practices, I think the first and the foremost would be how to implement a scheme as big as this. Just within 1.5 years, and the scheme was actually announced in February 2018, and on September 2018 it was launched. So within 6 months, how to design, how to put implementation frameworks in place, how to convince states to come on board. So a lot of lessons there, a lot of best practices there that we can share with the global community. The second one would be probably of course how to involve a huge chunk of private sector, how to design health benefit packages, how to ensure that all the aspirations and all the market related dynamics are included in the reimbursement of your package rates. So I think that would be the second one. The third one, which is a very critical one, is how to ensure that the implementation of scheme is completely digital and completely cashless. In the scheme that we have, the entire implementation that we do is through an IT system. There is not even any particular step which requires manual intervention. Everything happens through an IT system. So what it leads to is that it's a completely digital ecosystem which is there, and the beneficiary does not even have to pay a single penny. So it's a completely cashless system. So how to deploy such type of robust IT architecture, which can realize an efficient service delivery. So I think that is the third one. So I think these are some of the key lessons that we would love to share, and of course along with that how to build capacity at state level, at the district level, at the hospital level. As I said before, how to generate and how to catalyze that awareness within beneficiaries. So I think those are some of the things that we can probably share with the global community, and we would love to. We have been already doing that, with some of the exchange programs, with some of the other healthcare ecosystems that we have. Some of the things that we would love to learn from other countries, and from the health ecosystems of countries like South Korea or UK or US, Singapore, Thailand. First would be that how to institutionalize more emerging technologies in strengthening our decision-based policy making. So what will that include is that how can we use things like machine learning to track different types of utilization which is happening, to track what is the type of specialty-wise utilization which hospitals are filing for, how to see if there is any type of abuse which might be happening. So we want to see how to leverage this emerging technology which is coming in. The second one that I think is that we through Ayushman Bharat, the data that we are getting from the hospitals, from the beneficiaries, I think what would be interesting to learn is that how to widen the application of that data. How can we make different types of data models which will probably help us in understanding the utilization better, the progress of the scheme in a much better way, and probably even help us correlate with other data sets. To give you an example, we would love to see through our database, let's say if there is if we see that in a geography the number of packages or the number of utilization for a particular procedure like typhoid is increasing. So we want to see, does that correlate with the type of quality of water which is available in that particular region. So we want to crisscross different data sets. We want to see what type of insights comes out of it. And the third one, and this relates to the current situation, is that how to make schemes like this, which has financial protection at the heart of its scheme design, an essential part in serving communities during a pandemic or during an outbreak like a COVID-19. So what type of roles can we adopt, and how to ensure that the delivery of the scheme does not get affected. We would love to learn that from some of the other countries. Although we are trying a lot of things, but we want to see that what are some of the things that we can further try on to ensure that the value that we are creating during a pandemic can be augmented, and the financial protection that is the primary goal for us that can be increased. That those are some of the things that we would learn, that we would love to learn from other countries. When we talk about India, if you do not involve a community, your implementation cannot reach the person standing at the last mile. So it is extremely important to empower the communities. It is extremely important to inform the communities, and it is extremely important to make community a part of the decision making. So if what we have done is that design and suggestive guidelines and all, a lot of that happens at the national level, at the national health authority level, and then we recommend this particular design to the states. But we give enough flexibility to the states to actually tweak that particular implementation model as per their requirements. They give enough flexibility to the district to actually tweak the model as per the requirement of the districts, because no districts, no states are similar to each other, and that's why when you give that flexibility, what you are trying to do is that you are trying to include the requirements of the community, and also you are trying to inform the community in some way that what are some of the things that you want to see in the implementation of this particular scheme. And that has exactly been our focus. And I think even going forward, things like awareness generation, things like beneficiary awareness, capacity building, all those things, I think it will require a great amount of community participation. And finally the scheme is for the most poor and vulnerable population of the country. So from day one, our priority and our focus area on community mobilization has been quite strong. But I think as we move forward, I think we want to further strengthen that. So I think we are trying to explore multiple ways of how to involve the community, and we are trying to see what would be the best model to go way forward. In terms of the message, Jubin, I think this is a very different time, and also it's a difficult time. For the entire country of 135 crore citizens, we have not seen a time like this, at least in the lifespan that we have. And so it would require a lot of innovation. It will require us to break a lot of our inertias. It will require us to accept, embrace, and adopt new ways of living, new technologies. We need to probably get accustomed to probably a higher standards of maintaining hygiene. We need to get accustomed to probably live and work a bit more digitally. So the idea would be that in times like this, we need to ensure that we remain calm, and we as an entire country come together to actually fight this outbreak. Because here the outbreak is very, very peculiar, because here the citizens and the individuals are the carrier. It is not the water, it is not the air, but it's the individual which is the carrier. And therefore we all must come together, adopt new ways of living, remain calm, and ensure that we come out of this much stronger than ever.